Okay, hi. So I'm going to talk to you about the evaluation that we did, that I did with some of my colleagues of the Silver Line. I had to check, that's why it's not on the programme, that they were happy for me to say that it was the Silver Line. So the Silver Line's a national phone line, which I'm guessing people have heard of, which was set up by Esther Ranson, who had previously set up the Child Line. And then as she got older and found herself to be lonely, she decided to set up the Silver Line. So the Silver Line was launched nationally in November 2013, and that's about the time that the evaluation started. It officially started the following May and ran for 18 months. So I conducted the evaluation with my colleagues Michael Parker, who's a statistician. So the stats that I'm talking about today, Michael was actually doing the stats, and I have a sort of conceptual understanding of the statistics. And Professor Stephen Moore, who was the PI on the project. So that's all I need to tell you about that. Okay. So the Silver Line kind of grew up slightly organically, so it's a slightly complex service. And I'm going to tell you about only bits of the service, and I'm going to tell you only about bits of the evaluation because of the time limit. So there's these are the three main parts of the service. There are other things that they also do, but these are the three main parts. So if you call the Silver Line, what you do is you get through to paid staff who are based in Preston. I think they certainly were when we were evaluating, and I think they're still there, working in a call centre near Preston. And that's the blue square there. That's a 24-hour helpline. And that's one of their USPs, if you like, that they're open 24/7, and there's somebody there, you can always call them. So that's a staffed helpline, which you call. If a person calls that helpline and the staff think that this person could benefit from the friendship service, which they have, which is a befriending service, they call it friendship service, they'll say to them, would you like to do this? And people may or may not. Now, those are the two green squares are the friendship service. But what happens is when you say, yes, I'd like a friend, there's then a sort of interval while you wait to be matched to a friend. This is quite a process that they take quite a lot of care in matching you. So it takes quite a lot of time. So you go into wellbeing service. In wellbeing service and in the friends service, you receive a call from somebody, and that happens once a week. So that's the difference between the blue and the green, if you like. In the blue, you're calling the Silver Line. In the green, they're calling you. So, but it's staffed while you're in that sort of waiting pool. That's the wellbeing service. It's staffed. And then once you get through to having a volunteer, that's the friends service. And then that volunteer call you once a week at a time that you both agree and have a chat. The whole thing's conducted over the phone. Have a chat for sort of half an hour-ish, longer if you want and they want. So that's what the service consists of, more or less. Okay. So it's a mixed methods evaluation that we did, and we did a lot of different things. And I'm going to be telling you about these bits that are in bold. So we did a survey of the wellbeing and friends. We grouped wellbeing and friends together because people go in and out of these two services. So if you're matched up with somebody and you don't get along with them, you might go back into the wellbeing pool while they wait to match you to somebody else. So we bunched them together. We did a two-way survey of people in wellbeing and friends, 6 months apart. We surveyed people twice. We followed the same people up. We knew who they were second time around and compared their answers to the survey first and second time. We could only do that with the wellbeing and friends because the helpline's anonymous. If you call the helpline, there's no obligation to say your name. The Silver Line doesn't keep any details they log the calls, but they won't have your phone number or contact details or anything. So for any kind of follow-up we wanted to do, it had to be wellbeing and friends. So we did a wellbeing and friends survey, 400 people in the first round. By the second round, that was 251. So we got answers from 251 in both waves. We did an isolation survey. We wanted to find out how many people basically lived alone. So I'm assuming that this group of people sort of know the difference between social isolation and loneliness, but I'll just spell it out in case not. So social isolation is a sort of quantitative state of not having very many social contacts. Your social networks are maybe small, you've maybe got poor transport arrangements. You can't get out and do social things. Loneliness is the feeling that your social contacts or your social support are inadequate, either in terms of the quantity or quality. So loneliness is a subjective feeling. So the isolation survey, we were looking at social isolation. How many of these people actually live alone? And that's the helpline. So 534 people. And then the qualitative research, we did focus groups with helpline and wellbeing and friends staff, and we had 42 in-depth semi-structured telephone interviews with callers. We spoke to callers from all three services, because we were actually also interested in people. We'd been told by the Silver Line that people who called the helpline were also lonely. So they have repeat callers to the helpline. There's nothing to stop you calling every day if that's what you want to do, or several times a day, as some people do. So we were interested in speaking to some of those people too. Okay. So the research questions, we had various questions, and again I'm going to concentrate on the ones in bold. Who uses the Silver Line? Why do they use it, and how well does it suit their needs? And is there a measurable change in the loneliness of people using Wellbeing and Friends over 6 months? And then we also had other questions, which I won't go into today. So the characteristics of the people who use the Silver Line. So the methods that we used for that was wave 1 of the Wellbeing and Friends survey. This was the thing with 400 people. And the isolation survey, which was the people who used the helpline. The people who used the helpline, we asked far fewer questions to, because it was much more difficult talking to the helpline people. It was much more difficult practically to set up, because, as I say, it's a different set of arrangements about how they call and so on. So, and the measure that we used of loneliness was the UCLA 3. We used it because it was designed for, it's 3 questions, and it was designed for large-scale telephone surveys. And we also used it because they use it in the English Longitudinal Study of Ageing, which is a big longitudinal study. It's been going, I think, 12 years now, 6 waves. Every 2 years, they have about 10,000 people. So it's a really good resource that I think a lot of people are using these days to find out about ageing population. And so we wanted to be able to compare what we were finding out about the Silver Line callers with ELSA people. So that's why we used the UCLA 3. So the 3 questions that it asks: how often do you feel isolated? How often do you feel left out? How often do you feel you lack companionship? And the answers are hardly ever, some of the time, or often. So 3 questions, 3 answers. You score most if you say you're often. So the score goes from 3 to 9. So the higher the score, the more lonely you are. And you'll notice that those questions don't mention being lonely, and that's because of the stigma of loneliness. So people are often, reluctant to actually say they're lonely as such if you ask them. Okay, so what did we find? Okay, so we found, first of all, that women are overrepresented in both services. The helpline, as I say, I'm putting Wellbeing and Friends together, but the helpline and Wellbeing and Friends. So they were 69% of callers to the helpline and 73% of callers to Wellbeing and Friends. Now, in the population as a whole, aged over 50, which is what Silver Line says they cater to people aged over 50, it's 53% of women. So you can see that women are overrepresented there. 70 to 79-year-olds were also overrepresented in both services. And in Wellbeing and Friends, so these are people who've asked for a friend. In Wellbeing and Friends, 80 to 89-year-olds were overrepresented. So 80 to 89-year-olds, we had 34% in Wellbeing and Friends, and in the population as a whole, it's 11%. So quite substantially. So they're going to be, on the whole, women who are 80 to 89 years old. Okay, they're also likely to live alone. Helpline and Wellbeing and Friends, both 90% of people were living alone. Which was really quite marked. And so we did a matched sample from ELSA by the age and gender. So we knew the age and gender of the people who'd responded to our surveys. And in the matched population, it's 41% live alone. So you've got sort of twice as much chance that they're living alone. Okay, so, and we also found that they were much lonelier than their contemporaries. I'm going to show you this on a slide coming up. Also that they were less healthy, more disability and lower enjoyment of life. We used the CASP-19, which is a part of the CASP-19 about enjoyment of life. So on all of those counts, they were sort of worse than their match data set from ELSA. But what we really concluded from this is that these people calling the silver line had this kind of convergence of problems. It wasn't just one problem. It wasn't just that they were lonely. They have this mixture of problems which all reinforce one another. There was a survey done recently by the Centre for Ageing Better in 2015, Later Life in 2015 it's called, and they segmented the older population and they identified this group called Struggling and Alone. And when I read that survey, I thought, yes, those are the people who are calling the silver line. It's this group who've got, as I say, multiple related problems. So this is just illustrating the high levels of loneliness. So the wellbeing and friends callers are in the top bar there. The most lonely are the people on the right, that turquoise section. So you can see the ones who scored 9. Basically, they're saying often to every one of those questions, and that was 37%. In the match sample from ELSA, that is 4%. And then you can see, likewise, the pale blue, the sort of non-turquoise blue down the other end, 3% of the wellbeing and friends phoners scored the least lonely, whereas in ELSA, it's 49%. So they were much lonelier. Not that surprising. These are people who've called a helpline and said, yes, I would like a friend. Okay. Poor self-reported health. I'm not going to show you all the stats because there sort of isn't time. But the wellbeing and friends callers, when you say to them, how would you rate your health, poor or fair, 74% are saying poor or fair of wellbeing and friends callers, and else the match sample, 31%. So, and you can hopefully see the colours are the same at the other end. So that's just illustrating that point. Okay, so the other thing we wanted to ask, the other question we were interested in, why are people calling the silver line and is it suitable to their needs? And so the methods we used here were these 42 in-depth semi-structured interviews. As I say, with people who are using the Friends service, people who are in well-being, and people who were regularly using the helpline, because they were able to ask people who were regular users whether they'd mind having a chat with one of the researchers. And we also had focus groups with the helpline and wellbeing staff, and we analysed this thematically. Okay, and what we found, we found when we spoke to people that a way of making sense of what they were telling us was to describe it as their needs. And the callers seem to have these different needs. You could group people more or less into one category, but of course people also overlapped. People don't just necessarily have one need, but this is they might primarily have this need. So when we talked to them, we said things like, you know, what's it like having a silver line friend? How do you find the silver line? We weren't saying, why do you call the silver line? Because we wanted to be a little bit more, we wanted to let them answer more freely than that question would allow. But they started talking about their needs, in effect. So these are the different needs, and I'm going to take you through in the next slide just sort of example quotes which sort of sum those needs up. So I'll explain as I go along, but these are the different needs. Weiss in 1973 did this needs-based understanding of loneliness, and the needs that he talks about are social needs, which are slightly different from these needs. And it was actually only in retrospect that we sort of made that link between what we'd done and Weiss, but it's quite interesting to compare those two. So there's references to these slides at the end. Okay, so this is the companionship. We called this kind of like everyday companionship. So I'll read these out and summarise. So this is a person from a helpline advisor, one of the people in the call centre in Preston. They want somebody at the end of the phone who'll have a quick chat. It doesn't get emotional. They tend to be, what shall I have for my tea? Like that. What's on telly? What shall I watch? And then the staff, the wellbeing staff, so these are the people who are calling people. Some of the callers we have just want a bit of banter, a bit of flirtation. This is one of the women in the London office. So they said this, people calling asking what they think of the football results and things like this. People just wanting a little light-hearted chat. Okay, then people who want an in-depth friendship. And these are people, perhaps more what you'd think of as a kind of classic people who are going to join a befriending service. So we're talking to the people who, about their friends, and they were saying why they liked these friends. And they were saying, I have proper conversations. They're a real friend. They're an important part of my life. If I felt down, I'd tell her. This was a man who was living on his own, and he had asked for a woman friend, and this was somebody he felt he could confide in. Another woman, she's like me. She makes me laugh at things you might find it hard to laugh about. What we thought was interesting there was the thing of the reciprocal nature of friendship. The volunteers aren't necessarily looking for in-depth friendship themselves, but this is maybe what the callers, I'm calling them callers whether or not they're called because it's easier, but this is what the callers also, the callers maybe want a real friend. The volunteers maybe don't. It's just a question, I think, especially for anybody delivering services. Does this matter? Is that a problem? The reciprocality. Okay, the other thing that was really interesting, I thought, was this arm's length friendship. I've done quite a lot of research about the internet as well, and the sort of relationships that people form when you're not face-to-face with somebody, I think is quite interesting. And there's this idea that a close friend, somebody you confide in, has to be your close friend. Well, actually, people often confide in strangers, and this is what this was about. So this was a woman who had been married to a man who was alcoholic and abusive, and she'd left this man years ago. She was now an older woman, and but she'd never talked about it, and she felt she couldn't. She felt that she'd be judged by her local community where she lived, and she'd never talked about it until she'd phoned the Silver Line and had this friend, and then she'd felt able to talk about these things. So she said, I can tell her things deep inside, things I wouldn't tell other people. And she said, importantly, the friend is someone who wouldn't know me if I saw them in the street. So this is something about a phone-based service specifically that I think is very interesting. And then another woman, if you're not seeing someone, you're not seeing their reaction, you might be more guarded if you could see them. If they were looking grave in response to what you were saying, you'd try and put it right. You're more responsible for their reaction. So there's somebody who's developing a different kind of relationship because it's this arm's length relationship. Okay, buried loneliness. These were people who were the repeat callers to the helpline. And this is a person from the helpline describing those people. I'd say everybody that phones is lonely, and sometimes they have a different way of sort of expressing it, It might be like picking a fight with you on the phone, which is their way of saying they're lonely. And they said they had quite a few people like that, who it's actually quite difficult to, chat to because they're angry, which isn't necessarily maybe what you envisage when you do these things. So, okay, now this was a big thing, support for mental health. The Silver Line had got a lot of people calling with mental health problems, more than they had imagined they were going to call. I've got some stats here for you here about the cuts in mental health funding. And I would suggest it's related to this. So there was an 8.25% real terms reduction in mental health funding in the last 5 years. That was from 2015. So from 2010 to 2015, there'd been this big reduction in mental health spending. And I suggest that's one of the reasons why the Silver Line was really quite inundated with callers for mental health, with mental health problems. And I said to one of the helplines, how do you know? And she said, well, they'll say, they basically spell it out for you, or it's very evident the way they talk about a social worker or something like that. And these mental health problems may be quite severe or really quite mild. So we're taking the severe end here. How many of our callers say, I want to die, I don't want to live like this? They're worn out, they've had enough. They say, I've just had enough, I don't want to carry on. They've got such a poor quality of life, they can't even walk to the door. They're relying on carers who are on such low wages and aren't very well trained, who haven't got time for them. They said they saw a rise in calls when the mental health helplines shut down at night. Their calls peak. And then somebody at the other end, if you like, of the spectrum, I call them because I feel miserable, and they chat me out of it. So that's maybe a sort of less severe problem. But what we thought here is that with the mental health helplines, they may be dealing with the mental health problem, but they're not necessarily addressing the fact that people are lonely. And obviously, just because you've got a mental health problem doesn't mean you can't also be lonely. And in fact, possibly increases the chance that you're going to be feeling lonely. Okay, so I've sort of clumped them rather together here, but guardianship and worth. So there were people who clearly wanted somebody kind of calling up and checking how they were. And that's what so these are the people receiving calls from the Silverline, either usually in well-being. And why did they like it? They said they'd call up to check how I'm going, to see I'm still alive, that I'm not forgotten. And then a woman, I can phone my daughter if I feel a strong need to talk to someone, but receiving a call is a different matter. So this is a slightly different thing. It's not so much checking up, but a feeling that somebody actually wants to call her. That's the sort of self-worth thing. So that was why people were calling the Silverline. And then we sort of considered how suitable was the Silverline to these needs, to address these needs. And so we're thinking about both here the medium of the Silverline and the sort of, the services that they're offering. And we concluded that it works well for everyday companionship, that both the helpline and the wellbeing and friends, this kind of light-hearted chat. Worked well for this arm's-length confidant, both the helpline and the wellbeing and friends. And clearly the helpline was good at identifying people who had buried loneliness. So we're not saying actually I've just said does it work. It's not really so much does it work, is it suitable? Is it a suitable service for them? So when it is less suitable, when the medium isn't the right medium. So if what you want, for example, is a really close friendship, and for you, that friendship needs to be face-to-face, which of course it doesn't for everybody, but if for you a close friendship means a face-to-face friendship, then a phone line may help, but it's not going to really address that sort of inner yearning for a friendship. Okay, and also when the need isn't primarily social. So for example, the need for personal care. So this person that the woman was talking about, their carers haven't got time and so on. What actually those people might be lacking is personal care. And obviously a phone line can only do so much in that regard. And also when they need trained or specialist support. So these people with mental health problems who perhaps need to speak to a therapist of some kind. And also, the phone line is helpful. Maybe they can direct them to some services, but it's not really going to address the needs. And actually one of the things that the helpline callers said to us is that they found it difficult sometimes to refer people because so many services had been shut down. So they're then in a difficult position. They've got somebody who's got serious needs, but actually nowhere really to refer them on to. Okay, so this was the quantitative bit where we looked at the change in loneliness of people who were using the Wellbeing and Friends over a 6-month period. And as I say, we used the UCLA-3 to measure their loneliness, and we compared it with ELSA. We used difference in differences analysis, which comes from econometrics. And it was suitable because the intervention was already underway. So it wasn't something like a randomized control trial where you can say, okay, well, we'll have these people, these people can have the intervention and this is our control group. We couldn't do that. This was a phone line anybody could call. We couldn't sort of take some callers and go, right now you can't speak anymore. So there were ethical and practical reasons that we couldn't do something like that. Also, difference in differences analysis is useful when it's very complex, when there's going to be lots of variables. It's difficult, and this addresses the issue of today's how do you do these evaluations? It's difficult gathering this data, and one of the things that we did, we were spot checking, because the Silverline staff actually conducted the survey for us. We trained them in asking the questions in an appropriate way, and then we did spot checks to see that they were, asking the questions in the appropriate way. But when we were listening to the tapes of them speaking to people, it was evident how difficult it was, even just getting people to answer the 3 questions. Because people on the phone, they sort of go, you say, how often do you feel you lack companionship? And they'll start talking about their cat or something like that. So it's very difficult getting lots of information from people, so the difference in difference analysis helped there. Okay, and just to say, of course, we weren't showing any kind of causal effect. So we weren't saying, does the silver line work? We're merely saying, is there a measurable change in loneliness of people using the silver line? If that's very large, perhaps we can conclude, perhaps that indicates that it's beneficial, but we really couldn't claim any more than that. Okay, oops, sorry. So the key findings. So we did a mean score on loneliness. The Wellbeing and Friends mean score, average score, went down from 7.3, so that's the scale of 3 to 9, 7.3 in wave 1 to 7.1 in wave 2. ELSA, now that was over 6 months. ELSA's every 2 years. But we figured that at least, although ELSA's every 2 years, and ideally you'd be comparing 6 months and 6 months, that's a longer time, if you like, for people's loneliness to change. So if the Wellbeing and Friends was remarkably good, then this would work in the favour of the way that we were doing it. So ELSA's mean score went up from 4.3 in wave 5 to 4.4 in wave 6. So the Wellbeing and Friends reduction was better than ELSA by 0.272. As you can see, that is a very small amount. We've got a scale there going from 3 to 9, and we've got a difference of 0.272. And it was a statistically significant difference, but a small difference. So we had 39% had no change in their loneliness between the two waves, 34% a reduction, and 27% an increase. And I think this is something that comes out from this temporal change. Loneliness isn't something that's static at all, and we found that although when you take the population as a whole, you can say what was the mean score and so on, at an individual level people's loneliness was going up and down over this time period. So that's just a diagrammatic, a graphical representation of what we found. So you've got the well-being mean there falling over that time, and the ELSA going up. So, as I said, we found that most people's loneliness didn't shift, and when it did shift, it didn't shift much. So on the left-hand side there, you've got the number of callers, and at the bottom of the graph is their change in loneliness from wave 1 to wave 2. So whether their loneliness went up or down. So you've got most people there in the middle, 0. Their loneliness didn't change between the two waves. And then you've got a sort of normal distribution of people's loneliness increasing and decreasing, increasing to the right and decreasing to the left. So we also looked at, for each level of loneliness, how much do people shift between the two waves? And we found that the people who, so I'll explain this one. So we've got wave 1 down there on the left, and each of the loneliness scores, and wave 2 across the top. So where they have the same score between both waves, I've shaded the squares in grey. So those you've got a 0.4 probability of scoring 3 between 3 in wave 1 and 3 in wave 2. And so it goes on, and you can see there that the probability of scoring a 9 in wave 1 and in wave 2 is 0.65. So we found that the most lonely people were sticking where they were, which sort of chimes with other literature as well, because the other literature has said that at this sort of chronic, severe level of loneliness, this is John I think you say Cacioppo, don't you? Cacioppo, who's written a lot about loneliness, and he has come up with this particular theory that when you're lonely, if you're very lonely, you can get caught in this loneliness loop, and this is a sort of representation of what he said. So you're feeling very lonely, you're feeling stressful and anxious, and you have this negative evaluation and diminished self-esteem. This means you're hypervigilant, you perceive threat in the social environment, so you have negative social expectations, you recall negative social encounters better than you recall positive ones, you then adopt behavioural patterns which elicit these negative reactions, and you become distant, and you distance yourself from other people, and you can get caught. And I thought this was interesting as well to reflect on the people who call the helpline repeatedly and are angry. this is, I would, suggest there maybe this is the kind of problem that they've got. They're finding it actually very difficult to engage with people. So, conclusions. Okay, so what we concluded, the need to differentiate. Loneliness isn't one thing and there isn't one solution. And this is the main thing that we concluded from the Silver Line. So the Silver Line's good for some people, it works under some circumstances, but it doesn't help everybody. It's a good supplement to every other services. So loneliness differs in the nature of loneliness, which is the needs, and the degree of loneliness, which is the level, this 3 to 9. And you're going to have different services that are suitable according to each of those. Measuring loneliness is problematic. So this UCL3, is it the best measure? It's very brief, it's just 3 questions. Funders want you to measure things, they want to have quantitative research, but I'd suggest that you definitely need this mixed methods to really drill down into what's happening. So are we measuring it the best way? Does measuring tell us all we need to know? Then there's the problem of chronic loneliness. These are the people, these people in 9 who didn't shift, who have maybe got these kind of negative attitudes. Now, other literature has said that intensive educational or therapeutic programs work with these groups of people. A weekly phone call, is probably not sufficient. It might help at the margins. Cognitive behavioural therapy is one area. Some of these people with chronic loneliness, their loneliness may also be depressed. And then you've got, again, this problem of 2 different issues reinforcing each other. The Silver Line addressed this after our evaluation by setting up this Silver Connect service. I just read this in their annual report, actually, that they set up the Silver Connect service. So they were identifying people who they felt were particularly lonely and doing a sort of more intense, making a more intense effort to put them in touch with other services beyond their phone call that might help. So that was comforting that they set that up. And then the other question is that more fundamental solutions to loneliness. So things like housing, the various inequalities that they are, and how these are causing loneliness. And while a phone line might help, it's not going to address these problems that are actually possibly at the root cause. So that's me. Any questions? Or no, there's the next bit. Yeah. Okay.